Morning, guys. Just wanted to do this quick video on how to release your neck. Um, I've been having some neck issues with a little bit of neurological stuff going down into my shoulder. I have a history of a herniated disc from 2014 when I was heavy into lifting very heavy weights. So led me to this idea that I should probably share with you guys how I treat my neck. So we have very common conditions these days that affect the neck because, well, most of us that own smartphones, we tend to do this for hours, okay? And as a result, we have loss of motion, i.e. stiffness in the neck. But it's not that simple anymore. You have other symptoms associated with that. You have, with loss of motion, you have cracking and popping in the neck, what we refer to as crepitus. You have pain, obviously. You have headaches because everything ties up into the scalp. All right, the scalp it's not really skin. It's fascia. And it's like a swim cap, and it's riddled with nerve endings and blood vessels, as you know. So when the neck muscles pull and they get tight, they tend to create tension, lots of tension in the scalp, and you have headaches as a result. We refer to those headaches as cervicogenic, meaning they begin from the neck. Very easy to treat, actually. Other symptoms will include pain going down into the shoulder, numbness and tingling in the hands, and it's because of this posture. We actually have a name for that. It's called text neck. So people that do a lot of work looking down on their keyboards, driving, reading, anytime where your head is down for a long period of time. So this is not a perfect treatment. However, it is something that you can do for yourself, okay? And it involves manipulating the neck muscles, the ones that you can reach, even the chest and even the shoulder. One major thing to be careful with is if you touch something in there, and it pulses, that's a blood vessel. Don't massage that, because you can potentially release a plaque. If you're as old as me, you can get a stroke. All right, I warned you so. Okay, so review of anatomy. You have your big muscle here called your sternocleidomastoid. See that big thing pop there? You have one on each side, and they're like the biceps of the neck. When you look down, they shorten. Their primary function is to turn your head from side to side. When I'm flat on my back, I go to sit up. I use those muscles as well. All right, to stretch them, you have to look up. Well, we don't look up anymore, do we? Because we don't live in the forest. So anyway, that muscle is part of your triangle. You have a cervical triangle, you have an anterior, and you have a posterior. So that's how we divide the two, okay? So as far as the sternocleidomastoid is concerned, you start from the base of your skull, called the mastoid process. You pull down or you push up. All right. See how I profile my fingers? I go like this and I lift up. So as I lift up, I'm incorporating this motion of lifting the ear. And as I do that, I lift towards this bone. I lift and I rotate. All right. How much pressure? Tolerable. But you want to make sure that you're actually moving the tissue. And you do that on both sides, okay? Right here, just above the collarbone, there's this dense connective tissue that holds everything in place. So you want to just push. You want to push on the tissue sort of like into that gully where you have connective tissue and you're trying to break it up. So I profile my fingers like so. I push in, and I'll even do this with my shoulder blade. All right, and as I'm doing that, I'm rotating my head. All right, so that's almost like spiraling. I spiral this way, I spiral that way. My head goes this way, my shoulder blade goes that way, and I am loosening up the tissue. So we get back here along the sides, you have muscles that are called your scalenes, the Scalene brothers, anterior, middle, and posterior. They don't attach to the head, they attach from the neck to the first, second, and third ribs. Right here. So between those muscles, you have a gap. You see that gap right there? That's where your nerves come out, your brachial plexus. They come down and they supply sensation to the hands. So if your whole hand goes numb, you're potentially squeezing the nerves as they come out here. You can also squeeze your nerves as they come underneath this muscle that attached to the front of the shoulder, called your pectoralis minor. Of course, you can, if you have a herniated disc in your neck, that thing sticks out, it'll create numbness in your arm. So reach into the space there, and just like this, and you'll feel it, and gently. And if you're not familiar with this can be quite painful. So I'm hooking in and I'm pulling like this, okay? And as I do that, I might even turn my head this way just to kind of soften it up. I'm also going to rotate my head in the opposite direction. All right. I'm going to work my way all the way down to that space right there, the supraclavicular fossa right here. So I pull, and then on my nail side, I push, just like this. And that's where I rotate my head the opposite way. There you go. All the way to the top. And then get behind the sternocleidomastoid muscle again. And then pull. As I pull, I rotate this way. I rotate that way. And as I push, I rotate this way. With my head, of course. All right. And you can lift the whole thing up just like this. Make sure to use light pressure. Your carotid artery is right there. Okay, I can feel that pulsing. Your jugular vein is out here. And then you have your vertebral artery, which you really can't touch. It's inside the bone, series of bones. So after loosening this up, I reach up for the big trapezius muscle. I reach like this. Now it's a really big muscle, so I hook in. And I tilt my head. Or I move my shoulder blade back. Okay? So this is the same effect you would get if somebody were to rub your shoulders. All right. So that's it. So my neck is nice and loose. It's loose for now. We'll see how it's going to feel later on. It's probably going to get tight again, but hopefully that helps. Be careful. Do this regularly. In between manipulations, you're moving your neck. You want to make sure that your neck is loose. And how do you know if it's loose? It goes through a full range of motion. It doesn't have pain, and it doesn't crack. So if your neck cracks and is stiff and is painful, do this treatment. Okay? Have a great day. Thanks for stopping by.